Sometimes a little pain is all in a day's work, but when the pain is too much, Mississippi Sports Medicine and Orthopedic Center keeps me going. Their nationally recognized surgeons and cutting-edge techniques give me the care I need for all of life's adventures, and I didn't need a referral. 18 surgeons, 6 orthopedic subspecialties, and one focus, you. Mississippi Sports Medicine and Orthopedic Center, since 1984.
Accidents aren't planned. Mississippi Sports Medicine Orthopedic Urgent Care. You're in, you're out. You're better. Accidents aren't planned. Mississippi Sports Medicine Orthopedic Urgent Care. You're in, you're out. You're better. Accidents aren't planned. Mississippi Sports Medicine Orthopedic Urgent Care. You're in, you're out. You're better.
I always enjoy working in my garden, but it turned into a real adventure when I hurt my hip and knee. Luckily, Mississippi Sports Medicine and Orthopedic Center was there to help. Their nationally recognized subspecialized surgeons are efficient and patient-focused, and I didn't even need a referral. They helped me up when my hip and knee got me down. 18 surgeons, 6 orthopedic subspecialties, and one focus, you. Mississippi Sports Medicine and Orthopedic Center since 1984.
Cooking is not only my career, it's my passion. But when I was injured on the job, Mississippi Sports Medicine and Orthopedic Center stepped in. I didn't even need a referral. Their nationally recognized subspecialized surgeons have the highest quality ortho care in the state. They got me back to doing what I love fast. Mississippi Sports Medicine and Orthopedic Center has 17 surgeons focused on your specific injury. Schedule an appointment today and get back to your adventure.
If you'd listened to your wife and hired a professional, you wouldn't have a fractured wrist right now. How long will you wait? How much will it cost? And what's your wife going to do when this woman loses her lunch? Mississippi Sports Medicine Urgent Care will treat your bone, joint, or muscle injury without the drama of the ER.
Injured his arm. How long will you wait? How much will it cost? And where is the sneeze going to land?
Mississippi Sports Medicine Urgent Care will treat your bone, joint, or muscle injury without the drama of the ER.
Let's face it, you aren't just a man or just a woman. You are athletes. You aren't just athletes. You're a team. You're more than just a team. You're a family. You deserve Mississippi Sports Medicine. Mississippi Sports Medicine is more than just orthopedists. Collectively, our specialized doctors perform almost 10,000 surgeries each year. From our family to yours, any age, any sport, any injury, just come here. We've got you covered.
So you've injured your shoulder or your knee? And of course, you want the best care and the best doctor available. The doctor on the left treats shoulders and knees and ankles and hands, while the Mississippi Sports Medicine doctor on the right specializes in one body area and one area only, treating thousands of patients a year. Trust your medical care to one of our true specialists. Mississippi Sports Medicine. We specialize for you.
When an accident happens, you want efficient and expert care right away. You don't want to sit in a waiting room for hours, especially when you're in pain. Mississippi Sports Medicine now offers the convenience of a walk-in clinic with our Urgent Ortho Care Clinic. At Urgent Ortho Care, our staff can see and stabilize your orthopedic injury right away. Our highly skilled team of nurse practitioners have received expert training in orthopedic issues. X-rays and MRIs are available on site. Our X-rays are read in-house the same day, so you don't have to wait for a callback about your results. If you need casting or splinting, our dedicated ortho team is available to help stabilize your injury. The next time you have an injury, skip the wait and come to Urgent Ortho Care. We are here from 9 a.m. to 7 p.m. Monday through Friday. No appointment is necessary.
Healing together.
Healing together.
Healing together.
Healing together. Healing together.
Healing together.
Healing together.
Healing together.
Healing together.
Healing together.
Healing together.
Healing together.
Healing together.
Healing together. Healing together. Healing together.
Healing together.
Healing together.
Orthopedic surgery has a new home right here in the Tri-County area from the same group you have known and trusted for over 30 years. With state-of-the-art technology including cutting-edge robotic-assisted surgery and advanced imaging capabilities, the Surgery Center at Mississippi Sports Medicine provides medical excellence and outstanding patient experience you can depend on. Our new center offers updated amenities such as quicker appointment times and an orthopedic urgent care with extended hours so we can be there when you need us most. It's just one of the many ways Mississippi Sports Medicine continues to invest in the future health of the communities we service. And as always, you can expect excellence and compassion from our highly specialized, board-certified, and fellowship-trained surgeons. We're raising the bar in orthopedic care. Learn more, visit MississippiSportsMedicine.com or come see us at our new location in Flowood, Mississippi.
Every day is an adventure, especially with Charlie. But when Charlie gets excited, accidents happen. That's when Mississippi Sports Medicine and Orthopedic Center fixed everything. I didn't even need a referral. Their nationally recognized subspecialized surgeons are efficient and focused. They got me and Charlie back in action fast. 17 surgeons, 6 orthopedic subspecialties, and 1 focus. You, Mississippi Sports Medicine and Orthopedic Center, the highest quality ortho care in Mississippi since 1984.
I think our fellowship program is a great opportunity and a great experience for that year of educational pursuit in that subspecialty area.
I joined Mississippi Sports Medicine at the beginning of 2012. I had previously been on faculty at the university and did a lot of complex lower extremity sports injuries.
Well, I've been part of the fellowship program now for 13 years. I came in 2007, so I'm in my 13th year with sports medicine and being actively involved with the fellowship program.
Well, I started at Mississippi Sports Medicine about 20 plus years ago, and so I've been involved with it since the day I started.
I've been involved with the fellowship program 19 years now, about to start my 20th year. I think if you want a high volume, very busy, but comprehensive program, I would look here.
When they come here, they're doing a sports medicine and arthroscopy fellowship, a 1-year training program.
I think our program provides not only a comprehensive experience with our subspecialty trained surgeons, we really tried hard to check all the boxes for the skills that the fellows need.
Well, I think the strengths of this program are the volume of patients you see, the volume of surgeries you participate in.
Those number of repetitions throughout the year, the fellow is just not able to get out of here without gaining an unmatched experience that really puts them in a position when they hit the road running on their own practice, when they go out into the world, they're equipped, they're confident, and they're ready to go.
We spend a lot of time with these guys over the years, so we're looking for, people that are very personable. We want people that are really self-motivated. It's a busy program. It's a fun program. We want people that are here to learn and anxious to learn and taking every opportunity to learn.
Qualities we're looking for in an applicant mainly are, we want you to have done well during residency. You don't have to be the absolute top of your class, but we want you to have done well.
What I'm looking for is somebody who's here to learn, grow their skill. If I'm going to work with somebody for a year, I kind of would like for it to be somebody who's pleasant to work with.
We've added a lot of expert faculty, international experts, to help facilitate the educational process. We've also added some surgeons from Tulane University, Dr. Savoy, Hurd, and O'Brien. They've been a tremendous asset to the program.
The most rewarding thing is when the light pops on and you see somebody and it clicks and the movement is correct and it's in the right place for the right reason at the right time. So the improvement you see and the light bulb going off and the confidence that develops over the course of the year, I think it's just remarkable.
To watch them grow over the year is really beneficial. So at the beginning of the year, we're helping them through the case with every aspect of the case, and as the year goes on, they do a little bit more of every case, and by the end of the year, we're kind of, hopefully sitting on the sideline and just kind of helping them get through the case. So I think that's the most rewarding thing is watching their maturity and their skill as surgeons improve.
I think if you come to our fellowship, we will teach you how to operate. So you'll do 1,000 cases in a year. You'll do shoulder, elbow, hip, knee. You'll do foot and ankle. We will teach you how to operate. So we want to teach you how to be a good physician, a good team doctor, a good practice partner, and a good surgeon.
We really have, I would argue for the fellows, a best of both worlds type of arrangement where we have a private practice model that affords a lot of efficiencies for our fellows to do over 1,000 cases a year, but also an academic slant. And so they get that educational experience, that academic experience, that research experience that a lot of them really look for.
Some of us are going to be doing more general orthopedics, so there's definitely opportunity if you want to do foot and ankle cases, hand cases, or joints. Yeah. So if you're in clinic and you want to go see something else, they're pretty good about letting you leave clinic and go doing other cases.
This place definitely gets you high clinical volume. It's really good. It kind of shows you how a good business should run too. I think that's a blessing that you get to learn that side of the kind of practice management. Overall, you get a broad clinical experience with pretty good mentors and faculty.
It's been a great experience as far as the camaraderie within the fellows themselves and the families.
It's been great. The food's been great. People have been nice. The weather could be maybe a little bit better because it gets kind of hot and muggy at times. But really, no, it's been a great experience.
They also give us access to country clubs to play golf, go to the pool.
The gym, so we have a HealthFlex membership.
I'm from Mississippi. I grew up here. I love it here.
It's a good dose of Southern hospitality. It's a fun place to be amidst a brand new facility with excellent faculty and an unmatched case volume.
I've been involved in resident and fellow training my entire 15-year career, and I can honestly say that we have one of the best fellowship programs in the country.
So I think our fellowship offers significant advantages compared to other programs. We are very interested in technology and exploring that. We want fellows to be exposed to robotics and navigation.
One of the biggest strong points of this fellowship is our volume. I think this year the fellows are going to get 900 to 1,000 cases each.
If you look at the average program that the fellow applicants look for, they look to do at least 400 cases. Well, we do over 800. And matter of fact, you can do 1,000 if you wanted to.
We cover everything from the sheer volume of hip and knee replacements to partial knees to complex revisions.
We appreciate the relationship with our fellows, like we do. The attendings appreciate our relationship with each other as well.
We all work well together. We all enjoy each other's company. We all have a great camaraderie.
I like to kind of see, what they have to bring to the table, what they've learned at their program, and I try to learn from them even.
I'm less interested in any sort of scores or numbers that they have. I'm more interested in an applicant who is well-rounded, an applicant who shows that they are truly interested in becoming a high-volume total joint surgeon.
I enjoy teaching tremendously. I think it just brings a whole nother level of enjoyment to your practice, where you're giving back to future generations, not only taking care of patients, but also helping to take care of their patients in the future and help their career progress.
I think it's a complete fellowship program. You get access to
every portion of arthroplasty, partial knees, every type of total knee, complicated revisions, every type of total hip. The attendings here are amazing. They're easy to work with, they're fun to be around, they're great fellow advocates, and you know, they treat you unbelievably well. Being under the Mississippi Sports Medicine umbrella is a great place to be.
I chose the program here because they do roughly between 800 and 1,000 cases a year. They have an outpatient program which has been going on for several years now, and you get to experience that as well as the inpatient side of the program.
This is a great place to come. Cost of living is low. We have great restaurants. There's a lot of outdoor activities to do at golf. We actually give you a golf membership to one of the best courses in Mississippi with the fellowship. So, you know, there's a lot to do here and there's a lot to offer.
If you look at our program, there's nothing that we don't do. There's nothing that we don't offer that any other program offers.
If you want to be a high-volume arthroplasty surgeon who is going to be the dominant player in your community, this is the right fellowship for you, and it will be the most enjoyable and enriching year of your life.
I've been involved in resident and fellow training my entire 15-year career, and I can honestly say that we have one of the best fellowship programs in the country. This program, I think, is unique in the fact that when people apply here, they're very surprised to see that we have everything to offer. That certainly starts with the faculty and the diversity of cases and the volume of cases that we provide, but also this outpatient facility and clinic that we have now, which is state-of-the-art, where we do the outpatient hip and knee replacements. And we get a lot of feedback from applicants that have gone throughout the country, and we hear it every time that there's no other place that they've seen like this. We cover everything from the sheer volume of hip and knee replacements to partial knees to complex revisions. In total hips, we have surgeons that do the anterior approach, the posterior approach, and literally cover all the bases. We look for individuals that are interested in seeing a lot and doing a lot, hands-on type experience as opposed to more research heavy programs, but we certainly are interested in folks that come in ready to operate and come from a program where they're more hands-on. We've been fortunate to have very good fellows here so far, and we certainly expect that to continue. The interaction with the fellows throughout the year is really a big part of my enjoyment as being here at Sports Medicine, and that carries forward. We get texts and calls from fellows all the time in the future, asking questions and interacting, so it doesn't just stop when they leave here. It's a lifelong interaction. I enjoy teaching tremendously. I think it just brings a whole nother level of enjoyment to your practice, where you're giving back to future generations, not only taking care of patients, but also helping take care of their patients in the future and help their career progress. To anyone looking at a fellowship program, the hands-on opportunities that you get here is really second to none.
I was fortunate to interview kind of across the country, look at a bunch of different places. And something that really stood out about Mississippi Sports Medicine was the high volume of surgical cases we get to do. and in addition to that, the wide variety of pathology we see. The volume here is unlike anything I've ever seen. I've been in the program for about 2 months now. As of this week, I've done just shy of 170 cases. So usually the fellows here finish with at least 1,000 cases on the year, which is probably the highest volume I saw across the country on all the interviews I went. Typically we'll spend about a half day in clinic where we see patients along with the physician that we're working under, and then we typically spend about a half day in the operating room where we're flipping rooms, usually doing anywhere from 6 to 8 cases in a half day, so really staying busy. In surgery, we're performing parts of the surgery under the supervision of our faculty. They're also giving us tips on both big parts of the surgery, but also little things, how to hold a piece of equipment and how to be efficient and effective in the operating room. We're pretty spoiled here. We just built the new building out in Flowood that has an 8 surgery OR and also has several different clinic hallways. Surgically, we all have top of the line arthroscopic equipment. You have high definition screens, all the equipment you can ask for. Clinic space is the same way, fantastic computer monitors to really spend time treating patients. We also have the benefit of having a cadaver lab on site at Mississippi Sports Medicine, where we've had several teaching opportunities with our faculty and with some of the industry sponsors to learn there. I'm a big golfer, so when I heard that we have kind of perks at 4 different golf courses around the area, I was one of the first to jump on that. We also have a complimentary membership at the Madison Healthplex, which is probably the nicest gym I've ever been a member of. Where I did my residency, we've had a number of people come down here and do this fellowship, so I was able to talk to those guys who have been here and kind of see how they've transitioned from doing this fellowship and into practice. And pretty unanimously they said you get top of the line training here and you feel comfortable dealing with whatever comes in through the door in your practice.
My name is McCabe. I'm one of the Joints Fellows here at Mississippi Sports. I've been here for about 2 months now, and I've done roughly 160 cases during my first 2 months. I'm well on a pace for almost 1,000 cases during my year. I think I've done a great mix of cases during my first 2 months. I've done a majority anterior hips so far. I would say probably 80% of my hips at this point have been anterior hips. I've done a nice combination of knees, including navigation and robotic knees. I'm getting to see the best of both worlds. A typical day for me, I usually get to the hospital or surgery center about 7 a.m. There's really no pre-rounding or orders that have to be done in the morning. All the attendings have a nurse practitioner or PA that does a lot of work for them. And so really there's not a lot of responsibility on the fellows in terms of scut work. You definitely work alongside the attendings here. In clinic, you're seeing patients, and then if you have a question or something, you talk to the attending and kind of go over x-rays together or something like that. You're definitely working alongside them in clinic and in the OR as well. Generally, when you start off, they are doing the case and you're holding retractors and learning from them. After a couple weeks on their service, you're the one doing the case and they're watching you and instructing you and giving you tips about how you could do something a little different or a little easier. So it's really kind of a graduated autonomy you get that you start off and really learning and embracing what they're doing, but by the end of the rotation, you're doing the case and they're sitting there supervising and just helping you out, holding retractors and walking you through anything you don't know how to do. We do a lot outside of work together. Obviously, a lot of people that move here don't know many people here. We enjoy doing outdoors activities together. We also go play golf a good bit between all the fellows. So we've enjoyed each other's company for sure the past few months. You're not doing 1,000 cases of the same exact thing. You're working with 4 people that do it different. So that's something I was looking for. I wanted to see a variety of different ways to do things so I could pick what I like to do and take that to my practice and really mold it to my practice one day.
My name is Dan Grahl. I'm one of the current Mississippi Sports Medicine Fellows. I'm originally from Fort Valley, Georgia, and I did my orthopedic residency at the Medical College of Georgia in Augusta, Georgia. Upon completion, I was fortunate enough to join the Mississippi Sports Medicine Fellowship Program here in Jackson, Mississippi. I can tell you from the day I matched, there's been a family atmosphere of welcoming and providing everything that you could possibly need. Upon completion, I plan on joining Piedmont Orthopedic Complex back in Macon, Georgia. I can tell you my practice is going to be a general orthopedics practice with an emphasis on sports medicine. One of the benefits of the Sports Medicine Fellowship here is the ability to not only work with all the sports faculty, but the ability to work with some subspecialty physicians as well. These include joint reconstruction, foot and ankle, as well as hand physicians. They're all welcoming and eager to have you in the operating room with them. I can tell you this will be a valuable asset for me as I go forward and establish my practice in Macon, Georgia. The whole experience is an unbelievable one that is a great fellowship to be in.
My name is Justin Hallock. I'm one of the sports medicine fellows here at Mississippi Sports Medicine and Orthopedic Center. I did my medical school training at University of Tennessee and orthopedic surgery residency at Campbell Clinic. I'm planning on joining a practice in Decatur, Alabama, and I will likely have a general type practice with sports focus. There are many great things about Mississippi Sports Medicine, but two attributes that I think separate us from other programs are, number one, our ability to work with some of the arthroplasty surgeons within the practice. This year I've gotten to do quite a few anterior total hip replacements, as well as plenty of total knees with both our sports staff as well as the arthroplasty staff. I think this is a huge benefit to get reps in with these common bread and butter type orthopedic procedures. Another strength of our program, and something that I think separates us from other programs, is our open shoulder experience. After working with our 5 shoulder surgeons, we get a great experience in both primary as well as revision shoulder arthroplasty, doing both reverse and anatomic total shoulder replacements. This experience has been invaluable since I plan on incorporating shoulder arthroplasty into my practice. Overall, this has been a great year, and I can't imagine going into practice without it.
My name is Jay Smith. I'm one of the current fellows here at Mississippi Sports Medicine. I completed my residency at Marshall University, Huntington, West Virginia. I plan on returning back to my hometown of Jackson, Tennessee at West Tennessee Bone and Joint Clinic at the completion of my fellowship year. This year has been invaluable in my education and operative experience. We have a very heavy operative experience here with graduated autonomy by the end of the year. We were pretty much just being supervised by the attendings, doing the majority of the case on our own. We also have a mentorship model here that is greatly appreciated. Every one of these attending serves as a great mentor and resource in the future during our practice. And we learn from a variety of different surgeons, different techniques that shows us not just one way to do a procedure, but multiple ways, which will greatly benefit us in the future during our cases.
My name is Kyle Wilson, and I did my residency at University of Texas Medical Branch in Galveston, Texas, and I plan on returning back to private practice in Corpus Christi, Texas. I'm now a sports medicine fellow at Mississippi Sports Medicine, and I chose this program based on the tremendous amount of tradition that it had in my community. There were a number of graduates that finished this fellowship and were very highly respected. It really allows us to be exposed to a very successful private practice model, and in that gives us the opportunity to participate in a large number of cases and a wide variety of cases, all done at a very high level. given that the program's been around for so long, has such a tremendous amount of tradition, it really allows us to have a set structure. It allows us to have weekly didactics, attendance to numerous national conferences, involvement in research, really to the extent of whatever we can throughout the year. And certainly at the conclusion of this year, it's lived up to every one of these promises for me. I appreciated the opportunity.
My name is Grant Zarzour. I was a recent graduate of Mississippi Sports Medicine's Adult Reconstruction Fellowship Program. I was there in 2016 to 17, and I wanted to share a minute about why I think it's such a strong program and a fantastic option for any fellow looking to pursue a career in adult reconstruction. First things first is the number of cases. The amount of experience you get with the attendings in Jackson is hard to match. I did 650 joint replacements in the 12 months and got the opportunity to earn autonomy. All you can ask for as a fellow is that if you can use your hands and learn and progress each month, that the ability to do more and more of the case, all with the watchful eyes of some great attendings. That's certainly the case in Jackson. We were very busy and also very efficient, which was fantastic. I think a huge part of the process as well was financially learning about how that works with some of the business minds that they have at Mississippi Sports Medicine. To be able to pick their brains really helped educate me a lot on getting into private practice and trying to figure out how that all works. I'm in Mobile, Alabama now doing private practice. A few things to point out in Jackson. We lived just north of the city in Madison, my wife and I and 2 children. Had a wonderful experience there. It was about a 20-minute commute. Some people choose to live in Jackson in certain different areas there, but we lived outside of Jackson in Madison, which worked out very well. There's a number of different rotations, which is great. You get to see a lot of the different attendings and how their styles are: posterior hip, anterior hip, the partial knee, a lot of revision exposure, knees and hips. It's very valuable to be able to put all those different ways and methods into kind of how you'll build your practice when you get out. I'll tell you, when you leave Jackson after your fellowship for a year, really I think what I've taken away the most is the confidence in the operating room to be able to deal with a whole lot of situations that arise, both on the simple primary to all the way to the very difficult revision. So that's a huge plus. You get paid for call there, which is great. Weekday and weekend call, the call's not too bad either, so I think that that's a huge perk. Also, there's 6 other fellows there. There's 5 sports fellows, usually 1 or 2 other joint fellows, so you have a lot of other guys to hang out with and enjoy the year with. But the biggest impact to me in the overall experience is to be able to work with the quality of surgeons that are in Jackson and Mississippi Sports Medicine on adult reconstruction is unbelievable. I think a huge part of your practice when you get out is to be able to be an asset in the operating room and not a liability where you're still trying to learn. Obviously, you're always going to be a learner forever, but what you learn how to take care of in the operating room from Dr. Mehrle, Dr. Allman, Dr. Pickering, Dr. Stronach, and the team there is fantastic. So the more and more you look into this fellowship in Jackson, the more and more you're going to realize it would be a fantastic place to spend a year. Also, I'm thrilled to answer any questions you might have. Feel free to reach out to me directly. We'll make sure the contact information's on there.
Hello, I'm Dr. Larry Field, the Director of Mississippi Sports Medicine's Fellowship Program, and with me is Madison McClure, the Sports Fellowship's Director of Education and Credentialing. We are pleased that you're interested in our fellowship program and wanted to share some program details to help you better understand what our Sports Fellowship offers our fellows. Our organization's Sports Medicine and Arthroscopy Fellowship Program, now in its 26th year, has been and remains highly regarded for a number of reasons, including the fact that our sports fellows routinely perform over 1,000 surgical cases during their fellowship year, with the great majority of those cases now being accomplished in our new state-of-the-art outpatient surgery center. These surgical cases represent a very broad spectrum of both advanced arthroscopic and open procedures. Our sports fellows are very important to us and to our entire organization, and we have, over these many years, continually strived to improve and refine the experience and opportunities that our fellows enjoy while here with us. Our sports fellows work very closely and in coordinated rotations with 10 highly trained and very experienced subspecialty surgeons who are each very accomplished in their own right, including a formal rotation for our fellows at Tulane University in New Orleans, with surgeon faculty that includes Drs. Buddy Savoy, Michael Bryan, and William Hurd. In addition to the surgical experience that the fellows enjoy, an active clinical research program coupled with regular laboratory training sessions in our 6-station cadaveric lab and conference facility, as well as athletic coverage opportunities for the 50 high school and 9 college and community college teams that our partnership provides medical coverage for, offers a very broad exposure for fellows to all aspects of sports medicine. Our commitment to the fellows also includes a number of benefits and perks, such as free country club and gym memberships for the fellows and their families, 2 or more fully paid academic conferences, a formalized mentorship program, and also a number of fun social get-togethers with faculty and staff throughout the year. Our previously graduated sports fellows practice all across the United States, and we all remain closely connected through a coordinated online forum as well as via an annual Sports Fellows reunion. We invite you to learn more about our Sports Fellowship program, and be sure to visit our fellowship website at mississippisportsmedicine.com/sportsmedicinefellowship.
Hi, I'm Madison McClure, Director of Education and Credentialing and Program Coordinator for Mississippi Sports Medicine's fellowship programs. My team and I value our relationships with the fellows and enjoy making the transition from residency to fellowship as pain-free as possible. It is our goal to ensure your fellowship experience is the best imaginable, so you leave here proud to be a part of the Mississippi Sports Medicine family.
Thanks again for your interest in our fellowship program. Please feel free to reach out to us if we can answer any questions or help in any way. Thanks again.
Hello, and thank you for choosing Mississippi Sports Medicine for your orthopedic care. Each of our team members is here to provide you with the best experience possible. This video will give you important information you need before your surgery. If you have questions, please do not hesitate to ask with a phone call, your patient portal, or with a virtual check-in. More information on these topics can be found in our preoperative handbook, which you will receive at this appointment. If you've not yet set up your patient portal for Mississippi Sports Medicine, we encourage you to do so as soon as possible. This will help us communicate with each other about your surgery. If you need assistance in setting up your patient portal, please ask us today before you leave for instruction. By now, we have reviewed your specific surgical procedure in detail. In a few minutes, a staff member will visit with you to go over a few things prior to your surgery. First, they will discuss the surgical consent forms. When signing these forms, you indicate that you understand the specific procedure to be performed and some of the risks, benefits, and potential complications associated with the procedure. It is important that you understand what is being done, the potential benefit, and the potential risks of the procedure. Next, they will give you a narcotics agreement to read and review and discuss it with you. If you agree with this, you will need to sign it. They will then review a summary sheet of the information covered in this video and ask that you sign the sheet after viewing, verifying that you have watched the video and have had your questions and concerns addressed. Following that, our staff member will review your medications, prior surgeries, medical problems and allergies, and perform a brief medical exam. Copies of the paperwork you sign will be given to you to take home. Notify us of any discrepancies, questions, or concerns you have regarding your completed paperwork. Please be aware that you will not receive a final time for your arrival or surgery until the day before your scheduled surgery. During your checkout today, make your post-operative appointment for 8 to 10 days following your surgical date. If you do not make that appointment, we will make one for you. Also, be sure to verify with our staff your correct phone numbers, including an emergency contact. Things to do today or soon. Please make sure you verify that we have correct and up-to-date phone numbers, email addresses on file for you, and portal is active upon checkout today, including an emergency contact. Check insurance coverage. Confirm your benefits. When you get home following today's appointment, notify your primary and secondary health insurance companies about your upcoming surgery. You'll be able to verify the place and providers this way. Your surgical checklist contains information you'll need to do this. If your insurance company needs medical information, have them contact our office to verify your insurance will cover all aspects of the surgery. If you know that your health insurance is going to change between now and your planned surgical date, we need to know today before you leave, as we'll need to verify that we are an in-network provider with your new plan. This must also be done for the surgical center or hospital. If unforeseen changes occur with your insurance coverage, immediately notify us with the new information. Also, it's a good idea to check your insurance deductibles and copays. A Mississippi Sports Medicine team member may contact you regarding copays and deductibles prior to your surgical date. Pre-certification. If your insurance company requires pre-certification or prior authorization, the Mississippi Sports Medicine team will do this prior to your surgical date. We will inform you of any additional information you may need to provide to your insurance and alert you of any potential problems encountered. Pre-admissions. If your surgery is scheduled at Baptist Hospital, you'll need to undergo pre-admissions at Baptist Colonnades no later than the Friday of the week before your scheduled surgical date. If your surgery is scheduled at the surgery center, you will need to perform a pre-registration phone call. Additional arrangements. You will need a responsible adult to stay with you for the first 24 to 48 hours following surgery. During this period, you may be taking narcotic pain medication. Narcotic pain medications may alter your normal thinking. Please make no important decisions during this period. Please arrange for a companion in advance. You will most likely be non-weight bearing immediately following your surgery. Please assess your home in advance. Will you be able to safely enter and exit your home while keeping your weight off your leg? Do you have to go upstairs? Are bathrooms easily accessible? These are things that should be addressed prior to surgery. If you need assistance, please let us know, and we can work on arranging a home health evaluation for you. Again, it is best to do this in advance. You will likely go into a splint versus a soft dressing following surgery, with instruction not to stand or walk on your surgical lower leg. Do you have what you need at home? You will be provided with a physical therapy prescription as well as prescriptions for a knee walker. If you are at all uncertain as to how to use these devices safely, please do so prior to the surgical date. If you are not safe on a rollabout and require the use of a wheelchair, this needs to be discussed with us prior to your surgery. Wheelchair use will make you more sedentary, which increases your risk for developing blood clots post-operatively. These can be fatal. Therefore, it is imperative to discuss this with your primary care provider before surgery to help minimize your risk. They may need to evaluate you for the possible need for anticoagulants after surgery in order to protect you against developing a blood clot. This may take extra time. Those same considerations will also need to be made if you are unable to take or are allergic to aspirin. The week before your surgery. If you have any disability, leave, or accident insurance forms, please bring them to our Jackson office at least 1 week prior to the surgery. Allow 6 to 10 business days for completion of your forms. Notify our office of any illnesses you have had within 1 week prior to your scheduled surgery, including any skin issues such as scratches, abrasions, insect bites, or rashes. If another provider prescribes you a steroid medication or gives you an injection of steroid within 6 weeks of your surgery, notify our office. Let us know if you have any other medical procedures planned around the same time as your scheduled surgery so we can provide further instruction. Do not take any over-the-counter blood thinning medications or supplements around the time of your scheduled surgery. Prescribed blood thinners will be discussed with you and your primary care provider so that we can manage your medications properly. The day before your surgery. You will receive a phone call or portal message from our staff to discuss the time you'll need to arrive at the hospital or surgery center. You can ask any last-minute questions you might have and verify what medications to take or not to take prior to the surgery. Do not eat or drink anything at all starting at midnight the night before your surgery. If you are not in a cast or splint prior to the surgery, please wash your surgical foot or ankle with Hibiclens or an antibacterial soap and water the night before surgery or in the morning before surgery. Do not apply lotion or powder following this wash. Remove toenail polish from your operative side prior to your surgery. The day of surgery. You may be directed to take certain medications on the morning of surgery. If you are not given specific instruction to take any of your medications, do not take them, but instead bring them to the surgery center or hospital with you. You may brush your teeth the morning of surgery and go through your normal routine. However, do not swallow any mouthwashes. Wear loose-fitting clothing because it will be easier to put loose clothes over a bulky dressing following surgery. If you have long hair, braid, tie back, or pull it up. Remove contact lenses and bring your glasses in case if you need them to read forms. Do not wear perfumes or powders on the day of surgery. Bring a responsible person, 18 or older, who can drive you to and from your surgery and care for you after surgery. If the patient is a minor, a parent or legal guardian must accompany them. Items to bring. On the day of surgery, be sure to bring your insurance card and driver's license or government-issued photo ID. Your list of medications, including any supplements and vitamins you take, and a list of prior surgeries with a description of any anesthesia problems or issues you've previously experienced. If you were given any equipment to be used following the surgery, such as crutches, walker, or a knee walker, bring it with you. This is not something that the surgery center or hospital provides. If you use a CPAP machine or any other equipment daily, you should bring it to the surgery center or hospital on the day of your surgery, but do not bring your equipment into the building with you when you arrive. If needed, the nurse will ask your family member or companion to retrieve the device from the vehicle. Bring something to do or read while you wait. Complimentary Wi-Fi is available. It can be cold in the waiting room. Bring extra layers if you are cold-natured. After the surgery. Post-operative prescriptions. If you're having surgery at our Flowood Surgery Center and have chosen to use the pharmacy at Mississippi Sports Medicine, your prescriptions will be filled and ready for you on your surgical date. The pharmacy is conveniently located in the atrium of the surgery center. If you're having surgery at an area hospital, please ask our staff to discuss your options for easy pickup. Discharge. You will get written discharge instructions in the recovery room. These include your follow-up appointment, time and date, as well as the instructions on how to take the medications prescribed. When you arrive home, you will be taking a combination of medications that may be sedating. We ask that you keep a log of which medications you take, how much you take, and when you take them to avoid over-medication or under-medication. If your regular medications tend to be sedating, we will offer additional direction on your discharge instructions. If you use a CPAP device or other medical device for sleep apnea, we ask that you use this not only for sleeping at night, but also for any resting you do during the day. In a moment, my staff will come in to review your current medications, allergies, medical and surgical history, and perform an examination. If you see a primary care provider on a regular basis, please contact that provider for medical clearance prior to undergoing surgery. The purpose of this is twofold: to keep them informed about your surgery and so that he or she may provide medical clearance for the anesthesiologist who will be providing anesthesia for the surgery. Additionally, if you see a specialist, the anesthesiologist will need clearance for them as well. Please provide us a list of your pertinent providers. If you don't have that information available to you today, please send it to us via a portal message when you get home. If you have sleep apnea, we will often ask for a CPAP compliance report or clearance from the provider treating you for this condition. If you're on immune modulating agents, make certain that you've had a discussion with myself or my staff regarding the length of time that these medications will need to be held prior to surgery. This information is best obtained from the provider prescribing the medication. If you're on bone density modulating agents, let us know so that we again can discuss with you the length of time it is best to hold these medications if needed. If your planned surgery involves any work on bone, an abnormal calcium or vitamin D level can negatively impact your ability to heal. If you have a known vitamin D deficiency, you will want to make sure that it has been appropriately treated prior to undergoing surgery. This can be verified easily with blood work. Please discuss this with our staff. If you're on a blood thinner, over-the-counter or prescription strength, or have been diagnosed with a blood clotting or bleeding disorder, deep vein thrombosis, or pulmonary embolism, make certain that you notify myself or my staff so that again we can discuss with you additional precautions you may need to take. If you smoke, vape, or use tobacco or nicotine-containing products in any form or fashion, it will make you more likely to have problems following the surgery. Therefore, we'll ask that you discontinue any and all of these products until you've healed the surgery. Sometimes we may ask that you refrain from using these products for a period of time prior to undergoing elective surgery to minimize your risk. If this time frame has not yet been discussed with you, please let us know before you leave your appointment today. If you have uncontrolled diabetes, you will be more likely to have an infection following the surgery and more likely to have problems healing the surgery. We may direct you or your provider to help better control your diabetes prior to undergoing elective surgery. If your surgery is of an emergent or urgent nature, we will ask that you please contact the provider who helps you with your diabetes to better control your blood sugars in order to decrease these additional risks. If you're on chronic pain medications, we'll need to coordinate with that prescribing provider to best determine what acute postoperative pain medication regimen is most appropriate for you. If this applies to you, please notify us before you leave your appointment today. Our goal is achieving the best result in the safest manner possible. Reviewing your medical history, doing a brief examination, obtaining medical clearance, encouraging tobacco and nicotine cessation, medication manipulation, and better diabetic control are all factors that will help us to achieve this goal. We hope this video provided helpful information about your surgery. A staff member will be in your room in a few minutes to answer any questions and address any concerns you may have. You will be able to review this video on your own via our website, and most information is also found in our surgical handbook, which you've been given. If you have questions later on, please call us or message us through Patient Portal. All of us are here working to provide the best possible experience for you. Thank you for choosing Mississippi Sports Medicine for your orthopedic care.
Mississippi Sports Medicine and Orthopedic Center just gained a new personal assistant, but this time it's a robot. The center is now the first in the nation to perform outpatient knee replacement surgery using this machine. 3 on your side, Summer Tadlock with details.
It's nice to have another set of eyes, even though it's computer eyes, in the surgery, making sure that everything is specific to that patient and precisely done.
Meet ROSA, the new cutting-edge technology that is revolutionizing the way doctors operate, and it's all happening right here in our community. Mississippi Sports Medicine and Orthopedic Center is the only center in the country that has ROSA, and Dr. Trevor Pickering is the first orthopedic surgeon to put it to use.
What ROSA is a robotic arm that is connected to a very complex computer, and I can put information in that computer before the surgery takes place so that I can use ROSA to assist me in the surgery.
Dr. Pickering recently used ROSA to perform a total knee replacement.
It took a lot of preparation and a lot of concentration, but it went very, very smoothly. And the patient did beautifully and is already back at work 2 weeks later, and we couldn't ask for anything better.
Not only does ROSA offer a more accurate surgery for patients, but it also reduces recovery time. And the best part, ROSA is no additional cost to patients.
Those patients that were doing outpatient are having better outcomes and are happier when they get home and not having to be in the hospital. And if we can use ROSA to get more patients in that situation where we can do them and send them home that day, I think ROSA will have probably the biggest benefit of all.
Summer Tadlock, 3 on your side.
Everyone, I'm Annabelle and welcome to another episode of Maine and Mulberry. Today I'm so excited to have with us Dr. Austin Barrett with Mississippi Sports Medicine and Orthopedic Center in Jackson, Mississippi. Dr. Barrett, thank you so much for taking the time to be with us today.
Yeah, Anna, thanks for having me. Appreciate it.
We're excited to have you on. Just kind of to get started, let's talk a little bit about yourself. Are you from the Jackson, Mississippi area? And maybe you can give us a brief profile on what landed you in the orthopedic sports medicine world.
Yes, I grew up here in Jackson. My family, both my parents are from cities around Mississippi, and they wound up here. So I grew up here, went to school, high school at Jackson Academy here. My father was grew up in a physician household. My father was an orthopedic surgeon. He is actually one of the founders of our group that I work in now here in Jackson.
Wow! Oh, that's great.
That was interesting growing up in, and certainly got to see that side of things. And he actually helped cover. He was the team physician for the school I grew up in at Jackson Academy. So that was kind of neat.
Neat. What was that like? Was your dad the physician there for you guys at that time?
He was there for, gosh, a long time. And it was neat being out there and, having him on the sidelines and, just getting to cover things with him, different sporting events, and just seeing how he functioned and how he got to treat people and get them back out there playing. It was neat to be a part of. And we saw tons of people in our living room. He would just say, "Come on over. We'll saw him on our couch or on our dining room table." So we saw a lot of things at our house.
What a neat way to grow up. I don't think everybody can say that happened in their childhood.
Yeah, it was neat, and that was one of the main things that kind of got me into medicine and orthopedic surgery in general, was just seeing that, being a part of that, and just honestly, just the satisfaction of, seeing somebody who got hurt, being there when they got hurt, diagnosing it, treating them, and then having them go back out there and, seeing your success as they get out there and play and do what they want to do. So.
That's so cool. Kind of bring us back full circle now. Tell us a little bit about the current practice and your specialty.
So our practice, Mississippi Sports Medicine, we are a group private practice. There are 16 or 17 partners, several associates. We cover many fields of orthopedic surgery, and my field is sports medicine, and specialty is injuries of the lower extremity. So usually it's a lot of knee and hip injuries, and
with sports medicine, we do a lot of surgery and treatment through the scope. So small incisions, we go in, fix things, that way, and get people back to doing what they want to do. Sorry, go ahead.
No, yeah. My understanding is that you are a team physician for several Mississippi college and high school sports programs. Can you drill down on that for us a little bit? What schools and what does it mean to be a head team physician?
Sure, no problem. So that is a big part of being a sports medicine physician is being out there, being available, and just being present, covering a lot of sporting events for different schools. So I cover 3 teams or 3 schools. I cover, ironically, Jackson Academy, which is where I went to school, which has been just just an absolute treat to get back there and to cover my alma mater. It's been great being there. And then I cover a junior college, Southwest Community College, over in Summit, Mississippi. And then I cover Millsaps College, which is a local college here in Jackson. So it's, it gets, as my wife tells me every year, it gets busy during the seasons, and we're gone. We have to cover a lot of games. So
that's a lot of games. Yeah, between those schools, that's a lot of games. Do you help only one sports team like football, or do you cover multiple sports for those schools?
We cover pretty much all sports. I mean, we're
no kidding me on all those schedules. Yeah, you're busy.
Well, no, we don't go to every single thing. That's a lot. But we cover all the football games. We're there. That seems to be where they need us the most during the season. So we're there on the sidelines for all the games. And then we cover different things throughout the year. Go to different sporting events, soccer and basketball and baseball, and lots of things throughout the year. But what's involved in that is basically being present. I'm sorry. Go ahead.
No, I was going to say, I bet you do see a fair amount of hip and knee injuries when you're covering that division of sports.
That's definitely a lot. There's a lot of, especially knee injuries during the football season.
Yeah.
A lot of hard hits and cuts that get done.
Yeah. So, but you are primarily with football, though.
We the main thing, we're there covering every game, and our busiest season for sure in our clinic is football. That seems to be where a lot of injuries happen. But again, we cover lots of different sports, and some of the schools during the football season will I'll run a sort of a free training room clinic. So just whoever's at the school wants to come in, we'll just see them and kind of do a general evaluation of them there. So it's different things like that throughout the year. Sorry.
No, yeah. What is that like, having a kid come running, I guess maybe not even running off the field, maybe carried off the field with an injury like that? Does your adrenaline start going? Do you get into a fight or flight mode? What is that like?
It definitely gets your blood pumping for sure. I mean, you always
in a lot of pain. Yeah.
Oh yeah, for sure. And you always kind of hope for a boring game from your standpoint. You just watch the game and enjoy it. But when certainly you don't want to see kids hurt, but we'll go out there and our role generally is do initial evaluation either on the field or if they're able to come off on the sidelines, we'll evaluate them, and just to initially see if it's a severe injury and they need something more, or if they just need a minute to stretch and they're able to get back out there that game. So that's kind of our initial thing. And when we're out there, when I'm out there, the first thing I do is find the ambulance wherever they are on the field, just in case. Now, we rarely need them, but just in case.
Right. Yeah. Well, I really appreciate this. This definitely helps us better understand your role in sports medicine. So I appreciate you kind of painting that picture for us. But I would like to switch gears a little bit and kind of talk about the effects of the COVID-19 pandemic. What have the last few months looked like for you guys at the MOC?
Well, it's like for everybody, it's definitely changed how we've done business. And the last few months, during the peak of the season, the things that changed for us is we were still doing clinic. and surgery, but we were screening everybody that came through the door. We basically minimized how many people are going through the clinic, and during the peak of the pandemic, we were only seeing and operating on patients with urgent problems that had to be done. A lot of the other chronic stuff, unfortunately, just had to wait. Sure. And that has certainly changed. That's picked back up. But the other things we were doing besides screening and everybody wearing masks, the whole clinic, and which we still do. We're still doing the screening and the mask, but telehealth and doing phone call and video calls with people, just to things that were less acute. We could just do that through telemedicine.
I was curious about that, if you guys had picked up telehealth appointments. How has that been going? Have you done that before, pre-COVID-19?
We had the capacity to, but didn't use it nearly as much as we did. Certainly with orthopedics and when you're dealing with extremities, it's best to see and feel. Right? Exactly. It's hard to diagnose something over the phone or over a video, but we did it when we have to. But basically, we're back up and running with the precautions that we're taking.
Gotcha. From a healthcare standpoint, what do you anticipate the foreseeable future to look like in the world of sports medicine? And the question on all of our minds, do you think that baseball and football programs will get started up again here soon?
Well, that's a great question. We get asked that a lot. So for the future, it's hard to say. We keep up with the news, and I serve on a high school, Mississippi High School Association Advisory Board, and we're actually meet every week to discuss this exact thing and what the future is looking like, what we have to do to get specifically high school people and athletes back into shape, because they've been off for basically months besides doing stuff on their own. Right. As far as we can see for now, unless things significantly change, football, baseball, and as far as we know, everything's going to be back on track for the next school year. Now, obviously, if cases go back up or anything changes, then that may have to change. And I think for this season, the things that are going to be questionable are potentially number of people in the stands. Certainly precautions about how close people are, wearing masks, that sort of thing, because the pandemic thankfully is settling down some, but I think that the precautions that we've learned about are going to still be in place for a while.
Right. I know I sit here and think about a sporting event where everybody's in mask. Can you imagine that? It's
definitely going to be a different year, but fingers crossed. Hopefully, if everything still is looking good, we'll still have the seasons.
Well, I think you've made a lot of listeners happy today by hearing that the future of sports programs might be coming back to us soon. And so I know I'm excited about it. I'm itching to, and my husband is too, to see something on TV and actually attend an event. So you've made a lot of people happy.
Well, I hope I'm right. I hope so too.
Dr. Barrett, thank you so much for your time and your insight today. We really do appreciate it.
Thank you, Anna. Appreciate it.
Until next time, I'm Anna Bell, sending you all well wishes. This episode of Maine and Mulberry is sponsored by Tour Carnival magazine. If you like Maine and Mulberry, you're going to love this hyperlocal lifestyle publication in Carnival, Tennessee. Check out local content at www.tourcarnival.com or by downloading the Tour Carnival app in the Apple App Store or Google Play Store.
We got to build up for our retirement. We got to build up for a new vehicle and possibly a new home.
But everything that I'm planning to do, they are there. They're offering services. They're walking me through everything. I don't have to try to figure things out on my own.
The experience about going to BrightView and walking through the door and that family atmosphere that I get makes it worth everything.
I do it on my phone, and we can now do it on the computer, and they were awesome.
BrightView Credit Union.
So we can enjoy more. They made it really simple, really easy, and very convenient. I can sit on my couch and do what I want to do. Save it.
Spend it.
Buy it.
Charge it.
Own it. They sit down, they make the plan with me, and then we go from there to reach the goals that I want to meet.
I've been a member of BrightView Credit Union for 36 years. I would always recommend BrightView to my friends and family. They're a caring business. They're people, not just machines, and they know you and they want to take care of your business. They've been there when we've needed them, and the rates have been great, and the service has been excellent. BrightView Credit Union. Enjoy more. They know me by name. I'm not just an account number. I'm always talking to a person and never a machine. The service and the helpfulness have been really wonderful. I recommend them to everybody.
The best thing about BrightView Federal Credit Union is that we are part owners.
BrightView treats us like family. We walk into the door and they always have a smile on their face. The service is very easy and worry-free.
They know your name, that you're not dealing with a big bank. Whether it's on my phone or online, it's quick, easy, and accessible. A lot easier to deal with, you don't have to go through as many hoops.
They keep me organized and they go over and beyond for you.
BrightView Credit Union.
So we can enjoy more. Whether it's on my phone or on my computer, it's quick, easy, and accessible.
The staff at BrightView is awesome. They know you by name, and everybody's all smiles in the office.
Spend it.
Save it.
Charge it.
Own it.
Defeating child abuse and trafficking in Mississippi takes teamwork, and your local Children's Advocacy Center has skilled teams on their side. From law enforcement to counseling to legal services, their professionals make reporting and healing for victims and their families easier and more compassionate. Join the team and support Children's Advocacy Centers of Mississippi.
In the wake of COVID-19, stress is high. Families are in close quarters, children are restless, and parents are trying to cope. Be alert. Report child abuse.
There's a powerful tool to fight child abuse and trafficking in Mississippi: the phone. Call the Mississippi Child Abuse Hotline at 800-222-8000 to make a report. It's fast, anonymous, and the law. After a report is made, your local Children's Advocacy Center's teams step in with compassion and services for victims.
In the wake of COVID-19, stress is high. Families are in close quarters, children are restless, and parents are trying to cope. Be alert. Report child abuse.
This is important, but you may not want to hear it. Child abuse is affecting someone right now, right where you live. But Children's Advocacy Centers are here to help. CACs throughout Mississippi provide compassion and services for victims of child abuse and trafficking and their families. Consider donating time or money to your area's Children's Advocacy Center.
In the wake of COVID-19, stress is high. Families are in close quarters, children are restless, and parents are trying to cope. Be alert. Report child abuse. Child abuse can have life-altering consequences. Effective intervention and treatment are crucial, but not easy. It requires the diverse skills of many professionals in a variety of fields. In the past, building these skills through education and real-world training could be time-consuming and difficult, and many entered the workforce underprepared. Now there's CAST, or Child Advocacy Studies. CAST is a nationally recognized college curriculum that prepares students to work effectively in their individual fields, from legal studies to nursing, education to religious studies, psychology to law enforcement, and more.
The University of Southern Mississippi values the Child Advocacy Studies program because we've had a long-standing relationship with child welfare in this state. We've done a lot of training programs with those professionals, and we seek to lower the turnover and to make sure that the professionals are doing the best job possible.
Child advocacy studies are very important to us at William Carey University at the College of Osteopathic Medicine because we're training tomorrow's physicians. And one of our primary goals there specifically is to train primary care physicians who are going to be at the front line on seeing these children, and therefore we want them to be able to recognize and respond appropriately to any concerns of child abuse or neglect.
So with the child advocacy minor, I learned more about specific situations. You learn about child abuse, about policies, about the history of child welfare, and anytime you can be more informed of the history of the systems, you can better provide for and serve your clients.
Our students have responded extremely well to our simulations. I think they really enjoy getting the opportunity to see things and do them with a hands-on approach, and it really has opened their eyes to the importance of knowing how to recognize and respond to child abuse.
Even when they're making mistakes, they learn greater from making the mistakes than they would from just hearing it from a professor in the front of the room. So they learn things like how to interact with different professions, how to make a mandatory reporting call, and how to interact with children.
It's active learning. We do simulations, we do very important research projects, and that's the best way to learn.
I think that the CAST program has a lot of potential in the long term to not only reduce the prevalence of child abuse by early recognition and advocacy, but also to more effectively take care of the children that are the victims of abuse and neglect.
The School of Social Work really does provide for its students and prepare them for any aspect of the field of social work, and providing the CAST minor just increases that.
We're hoping that the CAST program will have a great impact on child welfare in the state, keeping those workers well informed, employed, and happy with their jobs, which leads to making sure families and children are getting the very best care that we can.
Available at many Mississippi colleges and universities, this program teaches students to identify child abuse and neglect, report it appropriately, and become community leaders in the fight against child abuse and maltreatment. Students learn using a dynamic combination of classroom instruction and real-world training. Many schools have created mock homes or courtrooms to enhance the learning experience. This allows students the opportunity to simulate an actual case of child abuse.
We've had a number after they take the first class
come back and say, I believe this is the skill set I will need to answer my calling as a helping professional and work with children.
They respond very positively. And what I do, for example, in child abuse of the law, first class I ask, anybody read an article this week, hear anything on the news, social media about child abuse? Did you see an incident of child abuse? No one raises their hand usually the first night. But by the second night, and the third and the fourth night, everybody has noticed that child abuse is taking place in our communities, in our state, and in our country. And so it makes these students more aware.
I think they're getting far ahead of mitigating, they're getting far ahead of prevention, and they're getting far ahead of an incident occurring, period, by having this comprehensive approach to child advocacy.
It's important for me as director of the Judicial College to be proactive and to try to be on the cutting edge of the training that we offer. And that goes for our colleges too, to make sure that CAST is a part of that conversation, because it's such an effective way to train our students and encourage them to pursue these types of careers.
Graduates will enter the workforce fully prepared, ready to work with professionals in other disciplines to eradicate child abuse.
To be in these CAST courses and to truly understand what it means to be a frontline social worker and to have that experience in the classroom, to me, will be a huge benefit for child welfare.
The people that CPS workers work with in the course of our daily activities will also have some knowledge, training, and experience with child welfare issues. That's police officers, doctors, nurses, lawyers, all of these disciplines that the CAST classes are open to. It's definitely a big plus for us at Child Protection Services if a worker has been through the CAST program before they come to work for us.
None of us can know what it's like for a social worker to go knock on that door for the first time after, there's been a report of abuse or neglect, until you go through one of those scenarios and really walk through that house yourself. And to me, it also gives us a greater respect for how difficult that job is.
For universities and colleges, adding CAST to their academic program is not difficult. In many cases, the courses already exist and need only an infusion of CAST curriculum. CAST is a relevant, practical learning experience using a multidisciplinary approach.
It teaches them what the role of Child Protection Services is. It'll teach them what the role of law enforcement is, what the role of the courts are, so that when they go out and are hired into these agencies, the confusion and the misunderstandings won't get in the way. And so from knocking on the door to interviewing the parent to looking at the child for bruises, they're going to be taught how to assess for safety and risk to that child. Our hope is that we will train students in such a way that they're like, yes, this is exactly what I want to do. They know exactly what they're going to be doing when they get there. They're prepared for that kind of work when they get hired, and they stay long term, and they have a bigger impact on their families. And so the Training Institute is committed to making sure that all professionals are trained in how to work together to make sure all of those needs are met.
For more information about how to participate, contact Children's Advocacy Centers of Mississippi at 601-940-6183 or visit our website, childadvocacyms.org. Open the door to a brighter future for our kids with Child Advocacy Studies.
Holt. Hello. Good morning, I'm Dr. Thompson.
Well, we're in for a sprained ankle. We think it's a sprained ankle today. She was playing soccer and hurt her ankle.
Can you tell me what was happening at the soccer field?
Playing soccer is tripped to the side.
Let's see, I'm just gonna move it. Does it hurt when I move it slightly?
Yeah.
Okay. Mom, what happened on her hip?
I'm not sure. She probably just fell. Maybe running up the stairs or something.
And I saw she's had a couple of injuries in the past with sports and then sometime at home. How often are you falling?
Typical 9-year-old.
It's been a little bit more frequent lately. So would you say about every week?
I wouldn't say every week.
Almost every week. Well, Mom, I'm gonna have you step out while we try to get her ready for an X-ray, okay?
Okay, is that necessary?
The machine, you know, you can't be exposed to so much radiation.
Okay. They're just gonna check and make sure that it's not broken, and I'm just gonna be right outside the door, okay?
All right, now you seemed a little nervous. Is anything going on at home I should know about? You sure? Are you really falling? Or is somebody hurting you?
My stepdad.
Okay. And how is he hurting you?
He punishes me a lot.
He punishes you a lot?
Mm-hmm.
And how does he punish you?
He hits me.
Hits you?
Mm-hmm.
I have another bruise. Does it hurt when I touch?
Mm-hmm.
No more bruises. No one on your side.
Yep.
Is that from him hitting you as well?
Yeah.
How often is he hitting you, Jessica?
Just whenever he gets mad.
Whenever he gets mad?
Mm-hmm.
That's okay. You're safe here.
How are you?
Good, how are you?
I'm good. My name is Lavonda and I'm from CPS and I'm just coming in to talk to you. Do you mind if I come in?
Yeah.
They called saying that there was an altercation between you and your husband. Can you tell me anything about that?
We just argue sometimes.
It's routine that when we come in, we do house checks. Do you mind if we walk around the house?
Because you can still assess whether or not they're safe without her telling you a whole lot of information, and we can set up a forensic interview. It teaches them what the role of Child Protection Services is. It'll teach them what the role of law enforcement is, what the role of the courts are, so that when they go out and are hired into these agencies, the confusion and the misunderstandings won't get in the way. And so from knocking on the door to interviewing the parent to looking at the child for bruises. They're going to be taught how to assess for safety and risk to that child. Our hope is that we will train students in such a way that they're like, yes, this is exactly what I want to do. They know exactly what they're going to be doing when they get there. They're prepared for that kind of work when they get hired, and they stay long term, and they have a bigger impact on their families.
For more information about how to participate, contact Children's Advocacy Centers of Mississippi at 601-940-6183 or visit our website, childadvocacyms.org. Open the door to a brighter future for our kids with Child Advocacy Studies.
$2.8 million youth run away each year. Right now in your town, there are homeless and runaway youth who need help. Sally Kate Winters Family Services gives kids ages 12 to 21 a safe place to stay, crisis support, and counseling to improve their quality of life. If you or someone you know needs help, contact us at 1-800-RUNAWAY or at SallyKateWinters.org. Sally Kate Winters Family Services, your safe place.
Daily headaches? It's a big deal. Dry eyes? It's a big deal. Difficulty reading? It is a big deal. At JEA, protecting your vision is a big deal. Our board-certified ophthalmologists offer complete eye care for the whole family. So call or go online to make an appointment today and stop by our optical boutique for your frames or contacts. Don't wait for headaches, dry eyes, or blurry vision. It is a big deal. Jackson Eye Associates. Your vision, our mission.